of innovation in healthcare. And that's why I want to talk to you. So we at Erasmus University, and especially at Erasmus School of Health Policy and Management, we are involved in a lot with the regulations on healthcare. And if we could join forces to develop data-driven care, can we then prevent the problems we see presented in these images? That's what I would like to talk about today. And I'm representing the Erasmus School of Health Policy and Management. And the Erasmus School of Health Policy and Management is a group of 150 researchers with different disciplines, all working on an efficient, accessible, and high effective quality healthcare system. And I presented one scholar here. This is Wienand van der Ven. Wienand van der Ven is a professor in insurance, and he developed a model for the healthcare system in 1987. He presented the model of regulated care. And in 2004, he said, I will eat my shoes if the Dutch healthcare system will change to the system we now have of regulated competition. And it worked. So what I want to show with this picture is that we, I think, are about to implement data-driven care. We will have a new healthcare system. And we did it before. And the Dutch healthcare system is famous in the world because it includes private partners to reach a public goal, a good healthcare system. And we did it before with our staff and with a lot of people, so we can do it again. And that's what I would like to talk about. What is needed for data-driven care and how will the system change? So what is my agenda for today? I first would like to talk about what is data-driven care so that we are on the same page. Then I would envision what could be a data-driven healthcare system. How would that look like? And then I would go back to the next question. If we have an idea about that healthcare system, how will healthcare system develop? What is the path? What are the scenarios we see in the literature that we can follow? And I will end with the lessons learned for policy and management of data-driven care. So what is data-driven care? I present here 3 examples of a project I'm involved with. It's Big Analytics, where on the lead with Philips, develop big data projects in healthcare and want to show how big data can improve healthcare. I give you 3 examples. So the first example is about chronic disease management with data. Chronic disease management with data. So this is with data analytics. So what the question is there is, can we predict whether and when an individual get, for example, a second chronic disease? Because we know that a lot of patients have not one chronic disease, but develop multiple, and then the cost of cares are rising, and also the loss of quality of life. If we can predict, can we then intervene? Can we prevent comorbidity? Another question is, and that is more not only on the disease, but also on the healthcare system, can we predict whether and when an individual is at risk for an unplanned admission in the hospital? We know when patients are admitted to the hospitals, especially elderly patients, they lose a lot of quality of life. So we want to prevent that. And can we intervene in time, which is not only prediction, but also intervene in time to prevent such an admission? And next is presented a data model developed in Valencia, and where they were looking, normally you would look at a certain set of risk factors that are connected, for example, with the heart. But with the big data, we can see new patterns. For example, is it connected to arthritis? Is it connected to depression? So with big data, we can have a new idea of prediction chronic diseases and have a better view on multimorbidity. That's an example how with data analytics, we can improve chronic disease management a lot. That's one example. Now a completely different example to give you the whole spectrum of data-driven care. So this is about treatment, time, and tracking. We have all tracking devices where we can follow people, we can follow devices, we can follow patients. And if we track people, can we then reduce the response time for patients with a stroke? So if we have earlier the medicine in their blood, then they have a better prospect on quality of their life. Or can we reduce the time that nurses now look for a device? And can we, if they have lesser devices on a hospital, because we can easily find them? Or, and this is very relevant for now, can we reduce the number of COVID infections? So by tracking, you know where a patient was, and we have discussed that. We see the discussion in the newspaper. So this is another example. We already talked individualization of healthcare. This is an example how we can individualize healthcare and then improve the timing and thereby the quality of care. a third example about what is data-driven care. This is about precision diagnostic and deep imaging. With the new MRIs, we have a lot of data, and this data can be analyzed in a way. Here this is presented by Context Flow. That's one of the partners in Big Analytics. You see there a picture, and next you see a series of pictures. And these are pictures in the database that look similar. So a physician can look from, what do I see here? Oh, other physicians saw this and this and make this kind of a diagnosis. And on the right, you see literature and also protocols. So the doctors are directed very quickly to find, could say your digital twin, a person in the databases that have exactly the same problem as this patient. So can we then select the best treatment, and can we improve diagnostics? So these are three different examples. They're all in hospital care. It can also be outside, of course, the hospital care, but they give an idea about the broad range of big data in care. So now I go to my next slide. So what is then a data-driven healthcare system? So a healthcare system, I should maybe first define, that is the actors that are involved to organize care, that the patients get care, that they get paid for the care, that there are rules set. So it's the combination of actors that take care of healthcare. And what I already said in the beginning of the presentation, the Dutch healthcare system is famous in the world. It's famous because we have private insurers that have a key role in how we organize care to set the quality and set the price. And they do that in a public system with public goals. So this is the center of this image in this slide. What is now happening is that with data-driven care, new actors are entering the system. So tech companies like Philips or Siemens, but also app companies, small biotechnical companies, mobile operators. So here you see a lot of new actors that are now at the outer circle of the healthcare system, and they will come closer. And there will be new relations between providers and tech companies, between maybe patients and app players. So this is what is happening on the actor side, but also happening in what kind of direction healthcare is developing and where we need a healthcare system for. So first is that, and I need to, go back. My own picture is on the topic, so I have put myself down. So here we see shift in the healthcare domain. So we see the shift from care to prediction. So the healthcare system was built for hospitals, was built to provide care, but now we see a move to prediction and to prevention. So in the future, we might see prevention in hospitals, which is a different setup. Another direction is that home will be the central hub of care and no longer the primary care physician or the hospital. That will also change. And the other thing is that the providers or patients will become data providers, and they will be co-creators of their care. And the third shift is that healthcare, and you see it already, is an innovation hub for the European economy. So healthcare is not only a place where we provide care, but also a place for innovation. So given the shifts in the healthcare domain and given the new actors, we presume that the healthcare system will change. And give you one other example to show what this new healthcare system might look. This is, you could say, a patient trajectory, customer journey. And the idea is that we look for the whole life course. So we start with healthy living, and then we go to prevention. Healthy living, we just want to improve, for example, our sports. With prevention, we want to prevent that we get a disease diagnosed. We have the disease. And this is a whole care what we want to include as one process. But this image is not from an insurer. This image is not from a healthcare provider. This is an image from Philips. And there you see how tech companies take a new role in the healthcare system. They are going to provide healthcare like hospitals did so far. So I now presented to you big data. This is data-driven care with 3 examples. And I also showed you the healthcare system. So the collective group of actors that take care of healthcare and how that is going to change. But the question is, how come we from the current system, where insurers play a big role, to the new system? And how does it look like? So here I go back to the literature of Thuot. You see published literature on how the first reform, so the Dutch healthcare system came into place, how it stands now. And she presents 2, 3, 4 different scenarios. One is a blueprint, and that is developing, it's like that you have a plan, and based on the plan, you develop the healthcare system. And the Dutch did it. I will explain it later. And you see it's a period from 1987 to 2006. So it's a long period. And if you go to the other side of the picture, the Big Bang, it's just in 2 years. And there you have the same scale of innovation, but in a much shorter time frame. So you can see, and that's the message of this image, you can see a reform of a healthcare system slowly or very shortly. And if you go to the below, then you can see the Dutch healthcare system is famous because it's really new, it's really innovative. So they make a big scale in the reform. Canada didn't make that big step. It was a small reform of the healthcare system. So it's also possible that the new healthcare system will only be a small reform. And that's what happened in Canada. And that has happened also with a lot of consensus. So these are the 4 different elements, and I will explain it in more detail later on. To the right of the sheet, you see what this reform of the healthcare system is about. What is going to change? The first thing is going to change is the balance of influence among the interests of the state, the market, and the civil society. So I already said the Dutch healthcare system as it stands now, there the market, the insurance company, play a big role in comparison to earlier. So there might be a new change where the markets play an even bigger role, or maybe the states come in. That's one thing we should consider when we talk about the healthcare system of data-driven care. The other variable we need to consider is the governance. So what kind of mix of instruments? Do we have legal rules like the GDPR? Do we have contracts? Do we have peer control? There will be a mix of instruments to govern data-driven care, and that mix of instruments is about to develop, and we need to manage that and to study that. And the third level where it's changing the obligations and entitlements of citizens and professionals. Already shortly discussed that citizens will become data providers and citizens will manage their care. And the same for professionals, they will have a different role. So what I want to share with this slide is that there will be different in scale and pace, how quick it goes and how slow it goes, and the amount of change. So here is the Dutch healthcare system, because we are in the Netherlands and we want to develop that here in Rotterdam with our partners. And what you see, the reform of the healthcare system is what happened between 1987 and 2006 is with a stronger influence of the market and civil society. So citizens play a bigger role. And it's also important to know it's not only the market, but civil society. And that will also happen in the future. I think citizens will play a key role. We also saw a new mix of instruments, more contracts rather than diplomas or entitlements. And we saw new obligations for citizens. You have to make your informed choice. So this is just a concretization of what I showed on the model. And the table, you see how long it took. The discussion on the healthcare, the regulated market started in 1980. And then we developed a lot of instruments to make the new healthcare system work. And I talked a lot with American scholars about the Dutch healthcare system, and you say you are so innovative, but you're also cautious. You only make the change after a lot of new instruments, a lot of consideration, and then you make the step. So what you have to remind is that we did it, and we did it slowly, and we did it carefully. So here I come to the next step. So what would be the scenario for the data-driven healthcare system we are about to develop? So we have the Big Bang, and that can only happen with a centralized control and a big short time frame. So if we expect a disruption of the healthcare system, we need centralized control. And that has not happened before in the Netherlands. So it's a not likely scenario. A mosaic, then there will be a slightly reform. So there will be not a big reform. The system will be the same as it is. But there will be some modification between what is the role of providers, what is the role of insurers, what is the role of citizens. And there will be a lot of, it's kind of compromise. So we will look at the different interests and find a compromise to make it work. The blueprint, what happened before, is that it's a big reform and it's based on a comprehensive framework for policy learning and development. I already mentioned the regulated competition. There was a framework, and based on that framework, the whole system was developed behind the scene. And then in 2006, there was a law and everything was in place. So they need a framework for data-driven care if we do the blueprint. Incrementalism is, there you need strong support for change and a willingness to come to agreement. So what I want to show is that we need to understand what is the case for now when we talk about data-driven care. Is there centralized control? Will there be a rational and a comprehensive framework? Or is there a strong support for change? That's the question we need to ask when we talk about the reform of the healthcare system that is necessary to make data-driven care work. So I sum up what I said so far to come to my lessons. So what is data-driven care? I gave you 3 examples: chronic disease management with data analytics, reducing treatment times, and precision diagnostic with deep imaging, all from big analytics. Then I said we will develop a data-driven healthcare system. What will it be about? New roles for tech companies, for citizens, for hospitals, and new instruments to govern healthcare, and probably to govern outcomes and quality of life. I think there will be 2 likely scenarios for the Dutch healthcare system to develop in this way. There will be either a blueprint or incrementalism. It will not be possibly a quick switch like a big bang. That's not the way it works, and there's no centralized control in our system. So the lesson, I will explain it in more detail. When we innovate, when we develop big data technology, and we want to overcome the dead valley, the funnel, or the fourth hurdle, we need also to consider in time the changes in the balance of influence between the state, the market, and the civil society. We need to consider the mix of instruments to govern care, and we need to consider the obligations and entitlements of citizens, professionals, and payers. So to sum up, how will that look like then? What do we concretely need to consider? So here we have, if we think about the balance of the state and the market and the civil society, then we had the new role of insurance between 1980 and 2006. And now we have to consider a new role for tech companies and a new role for citizens. When we think about the instrument for governments, we had to move from certificate to the contract. And now possibly we'll make the move from the contract to outcomes. What are the outcomes of care? When we think about obligations and entitlements, the obligations in the old system, or the current system, you could better say, was to provide data on cost and quality. That's what providers should do, and insurers, and citizens to make your choice. The new obligation might be that we innovate and predict. That's what we want. That companies have to innovate and predict well, and that patients need to manage their data and their health. The pace, we know that the last reform costed at least 25 years. And when we look back, we could say that it started a new reform already in 2000 with the electronic health record. And I was working on an algorithm already in 2000. So probably we are on our way already. And then 2030 might be the moment when we're ready. And the last is do we have a comprehensive framework? And what is that then? So it was regulated competition, and it might be responsible innovation. At least that's a framework that's often mentioned, and might something we want to consider. That might be a framework where we can build and predict how the healthcare system will look like in the future. So please follow us in developing health policy and management of data-driven care. We will do in several projects. We will do in big analytics, where we follow how big data can improve healthcare. We do in medical delta, where we have a program from prototype to payment, and where we follow a lot of projects in data-driven care and bring them to payment. And we have the convergence with Technical University, Erasmus Medical Center, and Erasmus University, where we want to work on new technologies and a healthcare system that is proactive with regard to health. Thank you very much, and there's now room for questions.
Thank you very much, Antoinette. Indeed, there are some questions from our audience. I'll start with the first question, which is about the role of consumers in this whole story. How can we elevate the role of consumers from simply being data providers to stakeholders? Someone is asking.
It's a very good question. How can we do so? So it's important to know that when we had the first reform of the healthcare system, we want to have the move from providers to the market. And what the government then did is to bring patients in a position to make that change. So patients have been, and there was a lot of investment in patient organizations, in clients interaction and co-production. So there is a lot of, I think policymakers have played an important role and will do in the future to bring citizens into the driver's seat. So they're not only data providers, but they also will be stakeholders. Another thing is that, and I don't know how it will work, but we all will become consumers of healthcare, especially in the earlier when we want to improve our health and we're not sick. And then we're consumers and we decide which we pay. So there is also a move where we are already in the driver's seat as clients. And the third option is that developing, and that's in the early stages, is that patients develop their own collectives to collect their data and provide care. So with digitalization, we can organize our own new type of organizations and become care providers. So you see it already happening in some cities where people make a collective to organize elderly care for themselves. So that is also a way where that will help. So I agree that that is possible. And as a researcher, we all follow this kind of initiative to understand how indeed patients can become stakeholders in the care that is needed. And I think there must be, that's another point, they must be presented not only as patients, but also as citizens, because as citizens, we need to pay the cost of healthcare. And we often go to patients as users of the care, but we need to include them also as payers of the care. Do we want to pay for this kind of care as a collective? Thank you, very nice question.
Right, thank you very much for your examples. Another question from the audience is more future-oriented. How can a single record for patients be established, perhaps even across EU countries, meaning that all data about one patient is unified in one data set available to doctors or startups?
It's also a very good question. I have been involved in the development of the electronic health record since 1990. I'm 52, I'm sorry. And then you saw very small records. So the first record we studied was one record in one hospital in the north of the Netherlands for diabetes. And then between, I think, 2000 and 2010, all hospitals developed their own private electronic health record that was fit for their job, fit for their. And you see now in the Netherlands and also other countries that some providers get really dominant in the market of health record. So that's a development you see, that they're more off-the-shelf health records, and then a couple of few providers that develop that record. And that is, of course, something that makes it easier to share information because they use the same format, and hospitals use the same systems. And I think, I'm not sure, but that's a question we can discuss maybe later on. That will be same with apps. So we have now many apps on many platforms, and there it's a hell of a job to get this information together. But might there be that certain platforms become more dominant than the other, and that would be an important step towards more integration of the data. Another completely different other direction is that we don't need this kind of standardization, and that we have deep learning to connect different data sets in a new way. So what I see is that there are different strategies to come there. Try to centralize, or just say we need big data to combine these data sets. But so far, if I follow it, it didn't happen. So it will take long. So we cannot be optimistic, I think.
Great, thank you very much. Then a third question, I think we have time for one. There's someone asking, chronic disease management might work well in countries with a lot of understanding about technology, but how can we adopt such technologies in countries with lower tech understanding?
It's a very nice question. So that's also about health literacy. So indeed, chronic disease management assumes that you understand the disease and you understand the data you get on your app. And moreover, it assumes that you are only busy with getting better. But we know that people with a lot of chronic diseases have other problems like debts, children to care for. So it's not only about managing your disease, there's much more at stake. So to answer your question, what we see is that, and that's also why we like to work with the Technical University of Delft, it's about visualization of data. How can we visualize data in such a way that's easy understandable? Or how can we bring data into people's life that it fits with the things they're doing? So it's really about new ways of presenting data, and do that, of course, together with patients. So we don't need this kind of text I'm presenting on my slides. There's a much better way to present this information. And there's a lot of information from different disciplines that we haven't used so far, and we need to use to bring health literacy further. So that is indeed, it's also possible at other countries. But I don't think data alone will solve it. We need to consider, and that's another step, to bring other data about housing conditions, work, into disease management. And that's also possible big data, so that we don't single it out that you only have to manage diabetes, but you have to manage your life.
Great. And I think here's someone who turns the question around. This person is asking, how can other countries like China, who are a bit ahead of artificial intelligence and big data, how can they learn from the Dutch health? Thank you very much. 3 minutes left. I'll repeat the question. How can other countries like China, who are a bit ahead of artificial intelligence and big data, how can they learn from the Dutch healthcare system reform?
So that's a good question. So actually, we have a lot of people from China visiting us every year to learn from the Dutch healthcare system. So what they often take from us is the models of care we provide and the instruments we develop to do it safely. For example, what we learned from China is that they implement it very quickly. So there's a good cooperation between China and the universities in China and the University of Erasmus University to learn. So we are ahead of the governance, we are ahead of patient participation, for example, but we're often, as I explained, slow in the implementation, and then China can do it quicker. And so there's a good combination of things we can learn from each other. And I think also that we want to have accessible healthcare for all, and that's something that's for us what we have, and in China they're still working on that. So there's a lot to learn from us.
Great, thank you very much. And then we have a question from a history alumni. I think this is a good take-home question, because it's about how to read up on history of healthcare. So this person is asking, with regards to Dutch healthcare, what's the best starting point in history to read up on this history? So what would you say is that period of time?
So the current history is Tuho. He wrote a very nice book between 1980 and 2006. So the current history is not history, of course. Then we have Abraham van der Zwaan developed a book about the healthcare system earlier, and how we came to a society where we take care of each other. There are many books. So maybe you can drop me an email, because I know a lot of researchers, and I don't know, but I'm not good at titles, but I would really like you to recommend you some literature and some scholars that do this work, and they're really interested to share their work with you. So may I do it like this?
Yeah, the contact details of Antoinette are on the website, so they can be found there, and people can. Okay, perfect.
Yeah, then I would like to thank you. Yeah, for your attention and for listening to me. And I hope I informed you, I inspired you to think further than your technology and think about the healthcare system. And if you want to learn more of us, follow us on the projects we do. Thank you very much.
Thank you very much.
Is het gedaan, hè?
Zijn we uit de lucht?